Hi everyone. Today we're gonna talk about schizophrenia. I'm Sophia and this is Nadal.
Hi, I'm Nadal.
So first we're gonna begin with a short video on what schizophrenia is.
Suppose you are chatting with your friend in a park. He or she is talking about a topic you just cannot stand. In fact, you are not even mentally present there, and you are often not in touch with the reality. This may mean you may be suffering from a personality disorder known as schizophrenia. Symptoms include catatonia, delusion, hallucinations, lack of hygiene awareness, and much more. Schizophrenia is a personality disorder which is more common in males than in females. A person with such a disorder may not care of his or her hygiene needs. For instance, rarely baths and does not care of his or her dental hygiene. Another symptom, delusion. A person believes on unrealistic thoughts. And hallucinations is when a person sees or hears which does not exist. Another symptom, catatonia, is when the person does repetitive or purposeless overactivity as a result of his or her disturbed mental state. Symptoms of schizophrenia appear when one of the neural circuit situated in the midbrain, called substantia nigra, overproduce neurotransmitter called dopamine and disrupts the balance between secretion of dopamine and acetylcholine. The treatment of schizophrenia includes medication, antipsychotic drugs such as risperidone, which stops the secretion of dopamine. Physical exercise is necessary to reduce catatonic effects. Still, more studies are needed to understand deeply the mechanism of a disease.
So the origins of schizophrenia. It was first identified as a mental illness by Dr. Emil Kraepelin in 1887, and then the first diagnosed was as dementia. By 1911, the term schizophrenia was a Swiss psychiatrist named Eugene Willer, and then Willer believed the term dementia precox was misleading. So, schizophrenia is a chronic brain disorder in which people interpret reality differently. People experience schizophrenia in small increments known as episodes. It's hard to differentiate these episodes from real and unreal experiences, so it can cause cognitive problems with attention, concentration, memory, and declining educational performance. It can also cause an individual to have suicidal thoughts.
What causes schizophrenia, you might ask? Well, the cause is not completely known. Researchers don't know where it exactly comes from, but they believe that it can be developed in your genetics, your environment, and your brain chemistry. Research has also shown that has a lot to do with the imbalance of neurotransmitters, serotonin and dopamine in your brain, which is your feel good hormones. The types of treatments available for patients with schizophrenia are psychosocial support groups and different psychotherapies. In the groups that they learn social skills, they cope with stress, and they identify early warnings of relapse. These are usually the things that people do when they have schizophrenia. It's the most common option. The effects of schizophrenia are pretty diverse. The symptoms and characteristics include delusions, hallucinations. This can be paranoia. Your belief system is different than most people. They can see things visually, they can hear things that don't exist, and their perception of reality is pretty exaggerated. They often lack motivation. Their speech can be disorganized, and sometimes they find it hard to express their emotions or find pleasure in the things that people usually find pleasure in. Their movements physically can be kind of odd as well. And a lot of research has shown that an indicator that someone has schizophrenia is that they lack proper hygiene. As for the desired environment for someone who's schizophrenic, like I said, treatment will help, and it will help reward them with a more productive, prolonged life. They thrive in supported employment programs, so workspaces that really help people that have mental disabilities. They also thrive in a stress-free environment. It lessens the triggers that could start an episode. It's really important that they have supportive friends, family, and I often heard that youth groups or faith-based programs can also help. It is super important that they are not around drugs or alcohol, because oftentimes when they're hallucinating or hearing things, they use substances to stop hearing those voices or stop seeing things. But it's important that they are taught how to cope in a healthier manner. This can also help by eating a nutritious diet and regular exercise, because it will be a non-invasive way and it's free to improve mental and physical well-being. How to generally communicate your emotions across the board is just to be honest and kind with your fellow neighbor. Talk to them about how things make you feel. It's really important that you show your emotions during this, because no one can not validate how you feel. No gaslighting or placing blame is super important. Gaslighting is a type of manipulation, if you guys don't know, and it can be very abusive. Listening carefully to what someone is saying instead of just talking right away or responding right away is important, so you can process what's being said. Now, how to properly communicate with someone that has schizophrenia is a little bit different. You have to speak clearly in a quiet but firm voice so they don't get offended or triggered. You use short sentences so it's easier for them to keep track of what you're saying. Being empathetic, validating them, avoid arguments, and that goes with everybody. Avoid arguing. No judgments. Remember that they're living a completely different experience from you. Respecting is always important. Being mindful of their situation. Accept that if they don't want to talk to you, don't pressure them into doing it. And use the same language that they're using to describe their experiences. So if they refer to something as Sally, say, oh, okay, well, what about Sally? When you meet someone with schizophrenia, it's important that you show positive ways, that you care, you're considerate, and you have concern for them. You give plenty of personal space so they don't feel claustrophobic. Verbalize that you accept them and support them for who they are. Focus the person on what's real, what's actually going on in front of them. Tell them that you're going to be there for them, and tell them what you're going to do exactly before you do it. This will allow them to see it in their mind, how it's going to pan out before you actually do it, and so they won't get scared or anything like that. Make them comfortable. This could include changing the music or the lighting, having any pets around, just to name a few, and also just be a friend.
So here are some facts about schizophrenia. And the first one, there are 5 subtypes of schizophrenia. There's paranoid schizophrenia, disorganized schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, and residual schizophrenia. And although the cause is unknown, this mental illness can be developed through factors as genetics, brain chemistry, brain abnormality, and environmental factors, as mentioned earlier. Now, schizophrenia typically appears in a person in their teens or early 20s. And about 10% with schizophrenia commit suicide and are more likely to have a drug or alcohol abuse problems, which is why it's important to not use drugs or alcohol around the people. And most people prefer to be left alone and are not violent. So that's usually a stereotype on them. If any students have any questions, now would be a great time to ask them.
Text us.
Okay, thank you. No questions. We're next. So here's a quick video about what hallucination experience they might have be like. We're just gonna watch a brief few seconds of it. Oh, and if you have like a trigger for like suicide or trigger warnings, you can step out right now if you don't feel comfortable watching this.
Where am I? Where are you going? Look out!
This is pointless. Even that kid knows you're stupid.
Outside.
Everyone knows you're stupid.
Don't go in there. Don't go in there.
Nobody cares about you. Why do you even try? Why do you even bother?
What are you looking for?
Everything's listening to
You
you.
don't deserve
The
happiness.
wine bottles.
See, they're laughing.
She's looking at you. They're looking at you.
Everybody laughs at you.
Everybody's talking about you. Because
Go
you're
ahead,
make you
stupid,
fat.
get some ice cream.
You don't want that.
worthless.
It'll make you fatter than you
You
already
should never
are.
been born.
Worthless.
Look
Pointless.
out.
All the alcohol. Just
Trash.
take it all.
Poison.
No, don't take that one. No, go over to the other one.
It's poison.
Grab a wine bottle.
Go ahead.
A couple bottles of booze. Just
Drink it. Eat
drink
it.
it until you're
Look out.
passed out. Nobody cares.
Pointless.
Where did they go?
Nobody loves you. No one could.
Some junk food.
They don't
Scream.
care.
The
See?
people. They're talking about you.
Even
They're,
he can't
because you're
even
such a
look at you.
loser. Oops, he's walking away because you stink. You smell.
Why do you
He's calling the cops.
bother?
You're stupid.
They're fake
He stands back
smiles.
turned you because he doesn't like you.
Going to get you.
Oh. And she
So that's just a quick example of what someone who has hallucinations during their schizophrenia episode may feel like. So we're gonna have an activity simulating the same thing. Now, if you don't feel comfortable doing this, you can go ahead and not participate in it. But I want you guys to get into a groups of 3 to 4 people and pick 2 people that will go first and just casually talk about random topics. These topics can be about like plans for the weekend, TV shows, favorite movies, just as an example. And then the remaining 2 people are going to whisper similar thoughts that you saw in the video while you guys are having a conversation. And this will go on for 1 minute each, and then switch, and then keep doing it until everybody has gone. So now that you've experienced that, I want you guys to discuss for a few minutes about what was it like to have someone whispering things in your ear while trying to have a conversation. And I also want you to discuss, did the exercise change any of your thoughts and opinions about what hallucinations are? So now we're going to check for your understanding for the lecture. So first question, what is schizophrenia? Yes, that's right. Schizophrenia is a chronic brain disorder in which people interpret reality differently. Now, next question. What are 3 things that contribute to the development of schizophrenia? Yes, the first thing is brain chemistry. The second thing is environment. And the third thing is genetics. Third question. What 2 neurotransmitters in the brains cause schizophrenia, and why does it cause schizophrenia? Yes, serotonin and dopamine. You guys are so good. Another one is imbalance of both neurotransmitters can cause schizophrenia. Now, how many subtypes of schizophrenia are there? This one was in the facts, so think really hard. Yes, that's right. There's 5 of them. And the last question is, at what age does schizophrenia typically begin to show? I know, this one's kind of hard. Yes, that's right, in their teens to early 20s. So for the second activity, I want you guys to just discuss what things help you communicate your feelings. I'll give you about a few minutes to discuss them. Now, in this portion, people can talk about like, oh, it's helpful to understand their feelings first, because before someone can communicate their feelings, they have to take the time to understand them. So they take the time to reflect. Another answer for this question could be finding the right person in the right time, because sharing your feelings and communicating is hard already. So finding someone that you can trust and be vulnerable with and intimate with is really helpful. So now that you've figured out what helps you communicate your feelings, I want you to think about what would help someone with a schizophrenic episode and how to help them deal with their feelings. Now, answers to this could be being a good listener, being an attentive listener, and understanding the person's feelings, and then giving them social cues that you're listening, like yes, uh-huh, or just by nodding your head. Another answer could be being mindful. Remember, as mentioned earlier, you have to remember that they're experiencing things that you may have never experienced before. So it's important to give them space if they need to, and allow them to talk and express themselves, and keep the phrases and the sentences short to really help them understand.
Thanks for hanging in there with us, guys. To recap, what did you learn today? You learned what schizophrenia is. You learned 3 to 4 symptoms, and how we treat people with schizophrenia with a mental disorder. You were taught a specific type of mental disorder. You learned where it came from and when, the causes, treatments, and effects, the appropriate environment to live in with someone that has schizophrenia, how you communicate with others as well as someone that has schizophrenia, and what to do when you encounter someone with schizophrenia. I really like that we were able to show those videos to you guys, because it really helps you open up your eyes and really put yourself in shoes of someone that has a disorder already. And from seeing those videos, like it's scary, having all those voices in your heads and seeing things and hearing things. So the important thing to just take away from this is to be empathetic towards others, realize what comes out of your vocabulary and your behaviors towards others.
And that concludes our lesson for today. Thank you.
Thank
Don't
you.
forget your homework later.
Oh, yes.